we're going to focus on pushing technique directly on the back. Pushing technique is always done one direction. So generally, most of the times we're going to go from medial to lateral or from superior to inferior, but that doesn't mean you can't switch it up. I'm going to just show some standard pushing moves. Pushing technique should be slower, a little slower, deeper, and even speed. When we're using pushing technique, you can work on muscle groups. You can work on meridian line as well. You can also, vary your pressure. Usually we do pushing moderate, but you can get pretty deep with pushing technique. You should be using your body weight. When you're doing pushing technique, you don't want to, if I'm going to push on the back, you don't want to, see, I'm letting my arm get away from my body. I'm starting here and I'm moving my body, not my arm. If your body moves, unless you're working on a smaller area, then you can just move your arm, but most of the time you want to get into more of a lunge position where you can move your body weight forward. Areas of our body we can use to push, you can use fingertips, thumbs, you can use fists, you can use the side of your palm, you can use the heel of your palm, you can use a forearm, and you can use the flat of your elbow with pushing. And so where I'm going to demonstrate pushing today is I'm going to demonstrate a bunch of moves for the back and then for the arms in the prone position, so we're going to focus on the upper body. Sorry. And with pushing, we use just a little bit of oil. You need enough oil on the body so you're not really pulling the skin, but you don't want to use so much oil that you don't lose your glide or that you have too much glide and you can't, get deep pressure. That's why I like jojoba oil, because I'll combine TuiNa with Swedish and deep tissue. I feel like I can do TuiNa pretty effectively with this kind of oil. So I'm going to start with, and a lot of these are listed in your acupressure book. So the first move is one to open up the bladder meridian. So we're working the bladder meridian, and then we'll sweep on the lateral sides of the body with our forearms moving backward, and then we'll come pushing down with palms all the way through the fingertips. So it looks like this. When you get in your stance, you want to get in a stance so you can lean forward, and then you might need to be able to, might have to move to the side of the table to get your body weight if you're going to move all the way through the fingertips. So we start here. First I'm going to use fists. So fists, you want to get your body more stacked, and see if I hadn't lowered this table, I'd be, having not great body mechanics for this. Go down to the low back, and now I'm moving over the posterior iliac crest. And then what I'm going to do is squeeze with my forearms, using my body weight, moving backwards. And then palms on the upper arm. And then you go all the way through the fingertips, and then you just slide back up. So it looks like this. You do with fists. Again, I went a little slow last time, just to describe where I was moving. Squeeze with your forearms. So your options when you're moving down the spine on either side, you could use side of palm like this. So now I'm in the laminal groove. Then when I get to the low back now, so you can transition to the heel of my palm over the posterior iliac crest. Squeeze in, palms, and then you move your fingertips. And then last, you can just use palms. So when you get down to the low back, just curl your fingers under, like so your hands aren't going into their glute, or you're not extending here. You should never be extending like this to keep your fingers out of the way. So again, palms. So you just curl them. Same. So you have 3 different options moving down the back. Okay. Now, if you just want to work directly on the back, on either side of the spine, You don't have to complete that move, but that's one of Dr. Joe's moves that he likes to do, opening up the bladder meridian and then pushing down the yin meridians of the arm. But if you wanted to, see, you could just work through the upper trap, rhomboids, lower trap, erectors, and then so you just slide back up, like so. And you could do this with this, side of palm, the heel of your palm as well. You could also use fingertips, like so. So again, fingertips. And you're going to switch sides, and you use the opposite arm. And I use this hand just to help support and give pressure. So you have a variety of ways you could just work down the back over the erectors, okay? If you're ever working, and you'll see here on Jeff, sometimes you'll see some sha come up. It's like gua sha, people are familiar with the technique. So you can use your hand like gua sha as well. This would be a little faster pushing technique to try to get some sha to come up if you're feeling that it's there.
What is sha?
Sha is like stagnation in the muscle tissue. It's basically like some metabolic waste. It's sitting around. So see, you can see a little coming up through here.
What is it?
It's generally like cupping. Cupping, gua sha. You'll learn those tools. I just do gua sha with hands. I typically don't use the tool. So I just use the hands to do. Yep. Just use fingertips.
Diaper rash on a baby spot?
If I kept doing, you might see more like blood stasis come out. It'd probably turn a little purple. Could be a little black sometimes in
Wow.
discoloration. But I'm just saying, if you see that, don't be afraid of it. I just would make your client aware. A lot of people will have that in their body. If you see it, doesn't mean you're doing anything wrong.
Does it?
Stuff comes out of their skin.
Well, if it comes to the surface, there's different grades in the Chinese theory of medicine, of stagnation. So this is just, what we call a little qi and blood stagnation. If I kept going over with that same kind of technique, more like gua sha, it was just pink, that would mean that the tissue doesn't have any stagnation really. It's pink, blood's coming to the surface, healthy. If the tissue doesn't change color at all, that means that there's a deficiency. There's not enough circulation and blood coming to the area. If you start to see purple or black raised lumps with cupping technique come to the surface, I see that once in a while with gua sha, that would be what we call blood stasis, where there's been an injury or overuse that at the cellular level there's so much metabolic waste trapped in the muscle tissue that blood isn't flowing through fast enough in the body. It's what we call blood stasis. It's not the blood's not moving at all.
Blood traffic jam.
Yep, basically. Not enough blood oxygen in the area. So when that happens, you get more of a collection of metabolic waste, and that rises to the surface. When you do regular massage, that will just push it around. But when we do cupping or gua sha, it actually pulls it out of the tissue to be recirculated and eliminated. So if you do cupping on somebody a number of times, like 5 weeks in a row, by the 5th week, like the first week there's blood stasis, second week there might be some, third week you probably see qi and blood stagnation, see that the 4th week. By the 5th week there won't be a whole lot coming up anymore over the same area. So that for me was a signal when I started using cupping and gua sha that, oh yeah, it's clearing out, because
So it's a great
5
way
weeks
to-
later it's not there anymore.
So it's a great way to get toxins
Yep.
out of your body.
Yep, when we learn cupping gua sha. But this is part of pushing, that if you push a little faster, you might see that come up.
And then, so what did you? So then you kind of spread it out a little bit.
What do you mean?
Well, you said if you see this, then you continued pushing on it. Is that
Yeah, I will until enough comes up.
Okay.
You don't want to have it, overloaded. If you bring too much up
Yeah.
of metabolic waste in the tissue, a person could have a reaction like they're sick the next day if they don't drink enough water, because you overload their system
Right.
with stuff that's in their body, but it's not circulating through the bloodstream. Does that make sense?
Yes.
So then back to pushing. So we had pushing down the back, fist, side of palm, palm, squeeze lateral side, then palm all the way through the fingertips. But then if you want to focus specifically along the spine on either side, you could just use your fist going from superior to inferior. You'd use side of palm. You could use fingertips. So just different ways to push.
Fist, palm, side of palm,
And palm.
fingertips.
And heel of palm. Now may I have that chair, please?
Did you have a question on that?
Well, I was just wondering, like with copy, the marks stay for a while. So like,
It's not that it leaves a bruise, it's the discoloration inside the bruise. That's what you're looking at. Because the mark will still stay. That's like getting, like getting a bruise, like a hickey from the suction. But what was in the bruise clears out.
Oh, okay.
So
like,
that's what we're looking at.
Doing this, like, because you said it like kind of brings all the waste to the surface. That like won't stay for like a while. That
No,
will just go
this will
away.
be gone like 2-3 days, usually. Sometimes it could take 4 or 5 days, depending on how much is there. So then next, I'm going to demo working on the upper trap, levator scapula area with pushing technique. So the idea here is that you want to have your body weight moving forward, but your body, the part of your body you're using, is actually following the surface. So I'm going to angle my chair this way because I'm going to do his right side. I'm using my thumb like this, okay? But then I'm going to brace with my other hand on top, okay? So without my other hand on top, it looks like this. See, I'm stacked. I'm just leaning forward. This is pretty easy to do. There's not a whole lot of pressure on my thumb joint. And I'm going from medial to lateral. So, see, along levator scapula, getting the upper trap. So to protect your thumb, see, you just add your other hand over the top just to give some more support. And so I'm not moving this way. See, I'm not going an angle like this, even though it looks like it. My body weight is all going this way. Everybody understand that? So all you do is lean forward and then just let that forward movement follow the curvature of the body. So if I'm trying to go this way, it's going to be really difficult. So I'm going this way. I just want to make that clear to everybody. So here, generally use the thumb pushing from medial to lateral. You do both sides. Looks like this. And really, this is mostly body weight. I'm just leaning my body forward. So that's pushing with the thumb. You could also try using a fist. This might be easier for some people. If someone's very petite though, it's going to be difficult to run your fist over the bony structure. You could also try using a heel of the palm. But using a thumb like this will be much more specific. So your options are here, fist. You could use a palm. So I typically would use my thumb, like so. So next move, working on upper trap and rhomboids. Here, you can use a fist, or you can use the edge of your thumb again. Now I'm working right along the medial border of the scapula. So there's a scapula, I'm getting right on the medial border here. Without my other hand over the top, it looks like this. Pushing. Pushing sometimes will look a little like deep tissue as well. But you don't want to do with just one hand. Important note, if you're going to use your thumb like this, make sure it's not hyperextending. You need to keep it perpendicular L shape for the most part. You can come a little forward, make sure it's not past here or else you're going to hurt your joint. So we start here, medial superior angle of the scapula, and then now I'm letting my body weight go this direction. I'm following the line of the scapula. Okay, when I work on the shoulder, my body weight's going straight forward, but now I'm changing my angle slightly, going this way. So that's pushing. Change my foot position. And this is mostly body weight. I'm not tightening anything. I'm just leaning my body weight right into it. Then you could also, if you work the opposite side, you have to change hands. Left hand works on client's left. Your right hand works on client's right. See, looks like this. when I brace with the other hand.